Hi, I'm Dr. Ali Hushman. Rowan University is committed to educating the public about the importance of higher education in our state and region. That's why we are proud to support the important programming produced by the Caucus Educational Corporation.
Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, Valley National Bank, Rowan University, educating New Jersey leaders, partnering with New Jersey businesses, transforming New Jersey's future. Suez, ready for the resource revolution. Community Food Bank of New Jersey. New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. And by Fedway Associates. Promotional support provided by New Jersey Family Magazine and njfamily.com. And by hipnewjersey.com. Live hard, work hard, play hard. You're from New Jersey, and so are we.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Welcome to One-on-One. One-on-Two, this case, we open up with our good friend Tom Weatherall. This is his 5th appearance here on One-on-One. President and CEO of Make-A-Wish New Jersey. And for the first time, it will not be the last, a very talented young lady. She is Ava Covington, a Make-A-Wish New Jersey Wish Kid. How you guys doing?
Pretty good.
Well, by the way, tell everyone what a Wish Kid is.
A Wish Kid is a kid who's fortunate enough to receive a wish from the Make-A-Wish organization from their chapter in their state.
And Make-A-Wish New Jersey celebrating what anniversary?
Coming up on our 35th in 2018, Steve. Yeah.
Wow. Tell everyone what Make-A-Wish is.
Yeah, we don't want to take it for granted, right? It's really a seemingly simple mission, but as you know, Steve, you're such a dear friend and been a dear friend for a long time. We're an so powerful mission. We're summed up in one sentence. Our mission statement: we grant wishes to children with life-threatening medical conditions to enrich the human experience with hope, strength, and joy. These 3 trigger words that bring our mission to life. As the medical community knows, as Wish children and their families know, Steve, it's come to be a part of essentially treatment plans for the medical community in helping their patient.
Ava, what was your wish?
My wish was a Lewis and Clark carbon fiber cello.
Oh, back up. You grew up where?
I grew up in Bloomfield, New Jersey.
Okay. Love music?
Absolutely love it, of course.
What did you face in terms of your medical situation?
So I was born with a heart defect called left anomalous coronary of the right valsalva. And pretty much what that means is one of my arteries takes a complicated route to the heart, which pinches another artery. So that causes oxygen to not flow as well to the heart. And that can be really bad, and the worst case scenario, causing cardiac arrest or even death.
And your wish was for this cello. Mm-hmm. We're going to listen to you in the background. Talk to us about what you love about the cello.
The cello, first of all, is just a beautiful instrument aesthetically. It's just beautiful. Like
I'm sorry, I'm looking at you right now performing, but go ahead. Keep talking to us.
Either if it's even an acoustic cello or carbon fiber or any type of cello, it just has a beautiful shape with the F holes, and it's gorgeous. And the sound, it's so deep and rich, and it's just, there's nothing not to love about the cello. It's fantastic, and you get to sit down while you play.
So you told me, Tom, that Ava performed at the gala this year.
Yeah, at our gala in June, 800 people. It was a room stopper. You could hear the pin drop, all eyes on Ava, and the power of her playing and her story, her backstory. And then her mom telling what led to this, and Ava coming out and playing, surprising the crowd, blew the roof off. So I knew I had to bring Ava to you, Steve, knowing how much you appreciate the arts and our mission.
You know, speaking of the arts, I just heard from our producers that in our green room, which I don't think is green, you met the great Christian McBride. Talk about talent.
He was so inspiring to talk to, and it was just so nice to
He's a
just
jazz
see
icon.
that connection between string players.
Did he know? I'm sorry for interrupting. Did he have any idea what?
No, just
No.
You just saw Christian walking out because we're talking about the
Yeah.
TV James Moody Jazz Festival at NJ Pack, and Christian's all tied into it. So you meet each other, and what happens?
organically, just Ava and he just start up their passion for music, for the arts, for jazz, and this young lady can play anything.
Beautiful, beautiful. Let me ask you. By the way, your website is up for people who want to get more information on Make-A-Wish. There are a lot of different nonprofits in this state, in this nation, in the world. What do you think makes Make-A-Wish so special?
So I just celebrated 15 years there, Steve, and I'll tell you, my answer to you today, I think is pretty similar to what I've given you in the previous times you've invited me on, but much different when I first joined Make-A-Wish. I came in thinking, you know what, it's probably a nice, warm and fuzzy mission, and that they do, and how wildly, incredibly humbled I quickly became. And all these years later, I see it evidenced on a daily basis, year after year, that Make-A-Wish brings something to the table. We pick up where science and medicine leave off, and that we're so much more than warm and fuzzy. But look, there's so many people who think that even that brings value, and they support us. Steve, I can't wait to be on again with you soon if you'll have us. There's a study coming out that we're waiting on that we got a peek into that's going to show, well, the medical community has known all along. I think one of the greatest testaments, in addition to a young lady like Ava and her family and the thousands of other families and Wish children here in New Jersey, 10,000 strong, over 300,000 in the United States, the testimonials that come in as to the impact of a Wish. The fact that over 80% of our referrals come from the medical community themselves, they know that what we bring is a value add.
Clinicians will say, we want you to meet this young lady, this young man, this kid, because we feel like you can help.
You better believe it, Steve. In fact, I just returned from a conference, a national conference, in fact, where Ava performed out in Scottsdale, Arizona, our national conference, and again, blew the roof off the room, where we heard our national medical advisor. He's the chief of hematology and oncology at the DeVos Children's Hospital in Grand Rapids, Michigan. And he and other panel, members of this panel, sharing with us that what Make-A-Wish brings, what they're trying to bring with science and medicine, oftentimes, this cure that they're seeking, it can wreak havoc on a body, right, on the human being. And he says, and sometimes it breaks spirits. We don't have the cure for breaking spirits, but Make-A-Wish does. We restore. You know, I mentioned earlier, one of the words that triggers our mission is joy. You see Ava speak. We know we reached her heartfelt wish, Steve. You see the joy she speaks of.
Ava, let me ask you this as we listen to Tom. What's it done for you?
For me, it has given me so much hope, since I remember being in that hospital bed day after day after day. And I could feel my spirit being broken, and I was unhappy, and I felt useless, and it was just a really melancholy time in my life. But music, this love of music, they were able to take it and incorporate it all into one wish, this cello. And ever since receiving it, I've just been so much happier. I've been able to share my love of music with everyone who was willing to listen to me playing my cello, and it fills me with joy just to think about it.
I'm curious about something. For young people, for all of us, not so young, dealing with what we think is insurmountable, and we hope for the best from the clinical and the research world, and, you know, God willing, people can get the help they need. What message would you want to send to them right now if they potentially maybe thinking, is this worth it? You say what?
I would say it's 100% absolutely worth it, from the bottom of my heart.
What would you say to all the parents out there for whom not every wish can be granted? There's not enough money, there's not enough resources, but what would you say to them?
Yeah, Steve, we fortunately here in New Jersey, thankfully, because of such a generous community here in New Jersey, we've not been plagued with that issue where we didn't have the funds. Still, we're running this long streak, coming up on 35 years, that we've not had to say no to a wish because we didn't have the funding.
Right?
However, but on that same breath, Steve, so that's what keeps, gets me up a foot off the floor in the morning to make sure we keep that streak going, right? But there's another side to that story. And this past year, we set another record, Steve, 530 wishes, but it's still not enough. We need to get closer to 650 to 700 because that's what incidence ratings tell us are out there of the number of kids who are probably diagnosed. The need's there. We've got to find them. We're still not finding them all. And so that's our plan coming up in this next year, our 35th anniversary, to attack that plan. And what do I say to the parents? I say, thank you for inviting us into your lives to meet inspiring stories, their children, their parents, and you know, if there's anything else I've learned, Steve, in the 15 years, in as much as people think we're bringing the gift to the child, to the family, you know, the gift, it comes back tenfold. You better believe. And you say about listening to you, it's pretty easy on the ears to listen to Ava play and speak.
Tom, thank you. Ava,
thank you, Steve.
Thank you. We promise you that we'll follow your career, your life, and you can come back with this guy or just by yourself and perform. Thank you. Thank you, buddy.
So much.
Thank you, buddy.
We'll be right back right after this. That was awesome.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We are pleased to welcome Dr. Laura Balsamini, who is Director of Pharmacy Services at Summit Medical Group. Good to see you, Doctor.
Thank you for having me, Steve.
Let's educate some folks. The opioid epidemic, overdose crisis, describe it.
So we're in the midst of, just as you said, an opioid crisis where, sadly, we saw 33,000 patient lives lost in 2015, whereby patients have been overdosing not only on prescription opioids, but subsequently fentanyl and heroin. But of those 33,000, over half of them were lost to prescription opioids.
Why do you say subsequently? Is there what's the movement from, all right, I've got this prescription for, I'm not even going to name, some painkiller, I hurt my knee, get a pain medication, opioid, but it gets cut off at a certain point, as it should, right?
Sure, sure.
What happens?
So because they have so much addiction involved with opioids, what happens is patients who have already got an inherent propensity for addiction continue to need more and more or want more and more. And when that prescribing, because it's a gateway drug, we call it, and once the prescribing of those opioids may cease, because technically the patient should be doing better, the injury or the post-surgery should have improved, they may need something more. And if they're not necessarily getting an opioid, they may start looking for something else. And sadly, they may turn to illicit medicate drugs like heroin.
Doctor, you know, the law that changed in the state.
Yes.
It now, help us on this, a couple of pieces of it. One, it limits the number of, I'm not sure if it's 5 or what it is, 5 pills.
So it's 5 days supply. So
5 day, I'm sorry, I apologize.
No, that's okay.
5 day supply.
It's actually one of the strictest laws that were passed in New Jersey, across the country, in our state, just right here.
That's a good thing.
It is, because the crisis, as I just mentioned, how many people's lives have been lost. We really need to do something to put a stop to it. And part of that is the law is one component of it, whereby, just as you just said, that first opioid prescription, if the patient hasn't had an opioid in the previous 12-month window, is limited to a 5-day supply. This was stricter than even what Massachusetts or New York passed, which was 7 days. And was really surprising was that this law did not allow for an exemption for example, post-surgical opioid prescriptions.
That's different as an exception. But there are other pieces to this initiative. Doesn't it talk about, the patient being, I don't want to say warned, but given valuable information about some of the dangers,
Sure,
right?
yes. So besides the fact that there's the day supply limit, the provider also has to look at the New Jersey Prescription Monitoring Program database. That's a requirement of the law now before prescribing. They also have to provide the patient with information, have discussions on the risks and the side effects of opioids.
What about coverage? Is there anything different about coverage in terms of what insurance companies need to do regarding treatment?
So we're starting to see, for example, CVS Caremark was one company that just recently announced that they would be limiting the amount of coverage that they will pay for if you have that particular prescription plan, that they'll pay.
For in-treatment?
Well, no, I'm specific, no, this, talking about prescription.
Okay, I'm sorry.
The prescription coverage,
Talk about the treatment part,
but the
if there's an
treatment
issue.
part, yeah, so also the law now has...
I shouldn't jump to that, I'm sorry.
No. Well, there's so many different components of insurance coverage, but specifically...
You're saying insurance is complicated? Hadn't heard that, but go ahead.
You need to have a degree just in that to get through it. Yeah, so in terms of inpatient coverage now, there's been an expansion under the law that will provide additional resources for patients that are suffering from addiction and get them the necessary help they need.
Can we talk about the whole thing about our expectations, right? You go in, you got the chart, the smiley face, the sad face, you know where I'm going.
Yeah.
1 to 10.
Right.
Describe your pain level. I'm like, okay, how do I do this? Where's the number? Okay. But there are expectations for what, A, the medical community, these drugs could and should do for me, and also, we'll talk about managing expectations.
Exactly.
Make it go away.
That you hit the nail on the head, because one of the things I've been educating our physicians on is the importance of taking the time to have that discussion with the patient on managing expectations.
What's that conversation sound like with a doctor and a patient? Talk to me.
So, Steve?
Yeah, I just hurt my knee. Doc, I need as many of these painkillers as you can give me.
Okay, so we would assess with the level, as you just said, in what range is it? Where's the source of pain coming from? Is it neurological? Is it inflammatory? I would have that discussion with you. Well, Steve, this is actually more inflammatory in nature. As you said, your knee, this isn't so much neurological. We should look at other alternatives rather than necessarily jumping
You can't just give me the big painkiller?
There's several risks and side effects with these drugs. If you want to know the whole list, are you ready for them? I'm glad you're sitting.
Really?
Yes.
A lot of risks?
Yes.
It's just not going to get my knee better?
Physical dependence, tolerance, you're just going to need more and more of them. Constipation, nausea, vomiting, dizziness, sleepiness.
Wow.
Yeah, those are not side
Are you
effects.
also educating others in the medical community about this as well?
Yes.
How are you doing that at Summit?
So at Summit Medical Group, we have large physician forum meetings. So basically presenting to our physicians, just as I mentioned to you, the key critical points to cover in a patient visit. That would be meet the compliance of the law for that patient counseling component, and tips and tricks. So, for example, as I just mentioned to you, assessing, is it neurologic? Is it inflammatory?
It matters where it's coming from.
Yes, it does. What are the options, or what are the alternative treatments? Not necessarily just an opioid. Perhaps we should be looking, as I said, at nonsteroidals, physical therapy, exercise, non-opioid medications as well, besides nonsteroidals. Yeah,
and we need to look more at alternatives when, in fact, they're appropriate. By the way, we're not in any way advocating one thing or another, because sometimes a particular prescription is the most appropriate once all the options are considered.
I mean, individualized therapy. But again, just keeping in mind from the very beginning that opioids may not necessarily always be the answer, and because they have so many risks associated with them.
And
respiratory depression and death and overdose. It's terrible.
And before I let you go, this is a national crisis, is it not?
Yes, it is. It's not just in New Jersey.
It's not overstating it.
No, 80% of the opioid consumption in the world is right here in the United States.
And New Jersey is in some ways hit even harder.
Yes.
For a whole range of reasons.
Sure. It is.
Doctor, I want to thank you. We appreciate you. I know there's more to talk about. We'll have you back. But you had just educated and helped an awful lot of folks in a short period of time.
My pleasure.
Thank you.
Thank you so much, Steve.
Okay. Stay with us. We'll be right back right after this. Thank you.
Thank you. Appreciate it.
To watch more one-on-one with Steve Adubato, find us online and follow us on social media.
Hetal Narciso is Director of Vocational Rehab Services, Jewish Vocational Services. Good to see you.
Thank you. Thank you for having me.
Tell everyone what your organization is all about.
So we're a nonprofit agency that helps people with disabilities find employment and become independent.
You know, we were talking right before we got on the air about people dealing with autism. They're on the spectrum.
Yeah.
I'm always amazed people don't know exactly what the spectrum means. What does that mean?
So it's the spectrum is what, I always say that.
Is there a range?
It is. There is, it's such a vast range of different individuals with different, symptoms, and also...
Hold on one second. Is it speech? It's not always speech.
It's not, no.
It's not always speech.
It's not always speech.
What else could it be?
It can also be just, difficulty with social skills, difficulty being in a social environment with a lot of people, being in an environment that's overstimulating as well.
Really?
Yeah.
So it's a range. And one of the things that you were saying before we got in there that you wanted to focus on is that employers, right? First of all, you got to help people, at your organization, you help people get ready to go on job interviews, to be effective in the workplace. But what about helping employers understand? What do they need to understand?
Yeah, so that's a really big part of also what our organization does. It's not only important to help our individuals prepare for employment, but also connect with employers and build partnerships where they understand why it's important to hire individuals with disabilities.
Tell everyone why.
Well, you know, I think everyone has an opportunity to work and become independent and be a part of the community as people with autism spectrum.
Someone says, well, I don't really know what I'm dealing with. Devil's advocate. Someone says, I don't really know what I'm dealing with here. How do I know that person's not going to be a behavior problem in the workplace, you say?
So the great part is that we provide the support. So JVS goes, builds a relationship with an employer. The employer will interview our clients, and they're able to be on the job and try the job as well. We're also able to provide support to the individual.
Give us one example of the support you're talking about.
Sure. So we actually had one individual that just got hired at Target. A job coach is with the individual on the job, and they're able to provide support and make sure that they're able to work independent.
A job coach?
Yes.
Your organization does that?
Yes.
The stigma part, I'm curious about that.
Yeah.
For those who are on the autism spectrum, how significant is the stigma thing today?
It's still very significant. You know, we still have to go out to the community and educate the employers on the benefits and also why it's important to hire these individuals. There's still the stigma where some will say, well, they're not able to do X, Y, and Z.
What about what they can do?
And that's what we focus on. We really focus on, we do job carving as well.
Job what?
Job carving, where we
that.
actually have an employment specialist go and meet with the employer and explain the individual strengths and abilities and carve out a job that they will be successful on.
How'd you get into this?
Well, I have a passion for helping others, and I think people with disabilities need the opportunity to also be part of the community and be independent.
I'm curious about this. We interview all kinds of people, all different walks of life. You grew up in Jersey City, I believe you said. Jersey City, New Jersey. How much of your passion for helping other people, particularly those who are challenged and struggling, how much of it comes from your family?
It definitely comes from my family. I also have family members that do have limitations and that also have learning disabilities, and I see the challenges and how it's important for them to be able to have the opportunities that we all do and be able to become successful.
It's personal for you.
It is, yeah.
Go back to the organization again. It's been around for a few years.
Yes.
It's been around for a lot of years. The range of services, as we put up, and get rid of my name, put up the organization again, Jewish Vocational Services. For those of you who don't know, people will say, oh, it's for people who are Jewish.
No.
Isn't it funny? It's not. Tell folks.
So it's an agency that we work with all different types of individuals. We not only help people with disabilities, but we also have education and literacy classes. We work with immigrants. We work with the veterans as well. So it's an organization that works with all different races and nationalities, and our beliefs and values are from the Jewish faith, but as we are located in Essex County, it's very diverse.
You know, people talk about so-called soft skills, you know? I always find that people talk about communication as a soft skill, and pretty serious consequences if you can't or have a hard time doing it, being effective at it. The so-called training around soft skills, what does that mean?
So, you know, it varies from each individual. There's a strong focus in our program on social skills and soft skill building, and that really is understanding how important it is to go into an employment site and greet your boss every morning. You know, say good morning, hi, how are you? Those are the type of behavior sometimes that, you know, an employer sometimes will say to us, well, the person's not personable, they don't greet us. And it's things like that that we practice at JVS with our clients, so that way they become comfortable in, you know, greeting everyone in the morning, so that way when they're on the job site, they can use what they learned.
You know, a few seconds left. What I'm curious about is, so many of us take the greeting of others for granted. And for someone who is on the autism spectrum, that is not so easy.
It's not, yeah. It can be very challenging and difficult.
And you have great empathy for these folks, for
Yes.
folks who are, I shouldn't say these folks who are dealing with these challenges.
Yeah, sometimes it's very hard for them to understand that those are the simple, little behaviors and mannerisms that are going to help them excel.
You love what you do.
I do.
And you're very good at getting a message out to a lot of people, and a lot of people are going to be better off because you joined us on One-on-One. I want to thank you.
Thank you so much for having us.
Well done.
I appreciate it.
You got it.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, Valley National Bank, Rowan University, Suez, Community Food Bank of New Jersey, New Jersey Sharing Network, and by Fedway Associates. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.
The New Jersey Reentry Corporation is dedicated to helping those returning from prison to have a second chance. Providing addiction treatment, housing, legal services, and health care goes a long way to helping people achieve healthy sobriety and to secure a job. For a person to remain independent, self-sufficient, and healthy, a job is a necessity. We're in the business of transforming lives because we believe that everyone deserves a second chance.